Hello, I'm Dr. Con Wen from Austin Regenerative Therapy, and today I am so thrilled to have the chance to have a conversation with the expert behind VSEL therapy, Dr. Todd Ovokaitys. We'll talk about uh, who Dr. Ovokaitys is, um, what are VSELs, and how did he get involved in this groundbreaking therapy and different clinical application of VSEL. Dr. Ovokaitys is a physician trained at Johns Hopkins in an accelerated medical school program, and he also received his fellowship trained in pulmonary critical care at Georgetown University. He also is known as a laser nerd, and I'm gonna have him talk more about that. And he's involved in this groundbreaking research in V-cell and is making a great impact in the regenerative space. Let's talk about what are these tiny miracle cells.
Ah, very good question. Thank you, Dr. Kanwin of Arts Regenerative Therapy. It's a beautiful space here, my first
Thank
visit.
you, thank you.
And I'm quite impressed that you are really innovating in the biohacking and regenerative space. We'll talk more about that today.
Yes.
And the combination therapy that we'll be doing today, which will be my first time experiencing it. The V cells, which is an abbreviated term for the long phrase, very small embryonic-like stem cell that is abbreviated VSEL, and we just call them V cells for short. They've been very controversial for an interesting reason. I'll go into their background. The very earliest cells in the body are called embryonic stem cells, which after the first cell divisions, it's a very small group of cells. And at about the 30 cell point, there's still embryonic stem cells, and each one of those cells can make a whole new person. They're called totipotent. They're the one type of stem cell that has the known potential to create benign tumors called teratomas, which are weird. They can be literal giant cantaloupe-sized hairballs with skin and teeth and hair and nails and muscle and bones. So they're generally benign, but sometimes they can encroach on vital things and need to be removed for that purpose. Just past totipotent is pluripotent, and pluri means many, potent is powerful. So a pluripotent stem cell can't make a whole new person. It's already been proven by various lines of evidence that they don't form tumors. However, they can form the three primary germ layers, which you probably recall from biology. I'm sure you would, and probably most people listening would, the endoderm, mesoderm, and ectoderm. And those three layers then form all the tissues of the body. So a pluripotent stem cell, by extension, literally is capable of forming everything in the body. The V cells were first discovered in mice around 2006. The pioneering work was done by Dr. Radachak from the University of Kentucky, Louisville, and he's been a brave pioneer. There were even scientists that said the V cells don't exist. And the reason that would be is that for unknown reasons, these cells go into metabolic hibernation when we're born. They have such low energy that if you do a special type of stain called the trypan blue exclusion, they look like they're dead. They don't have enough energy to pump the dye out of themselves, unlike cells that have full metabolic machinery. So they're so metabolically inactive, they don't function like a typical cell, and they could really be viewed just as cellular debris, which was the argument for their non-existence. However, once they are biologically awakened, and they do sometimes normally, if there's a big stress, heart attack, stroke, motor vehicle accident, they'll come out of dormancy to allow an accelerated and more complete repair. But then they go back into metabolic hibernation. Because they go into metabolic hibernation, their cells aren't dividing. And as you know, when cells divide, the telomeres get shorter, so the telomeres stay long. They remain biologically young. They can remain even as young as they are in umbilical cord blood, is where I first read about them in Radachak's book. So it's almost like our umbilical cord billet is circulating at body temperature, remaining to be awakened and used. Because they're pluripotent, they can make anything.
Mm-hmm.
There's also evidence that depending upon the chemical environment in which you culture them once they're awake, they'll become whatever that chemical environment suggests. So they can be made into neurons or pancreatic cells or muscle cells or cartilage cells. So they've shown that they can become all the different types of tissue. And then there's another factor that tells them what to become, which is cell-to-cell communication. So once they adhere to where they're going, they get told to become a nerve cell in the brain, or a heart muscle cell in the heart, or a cartilage cell in a joint space. The fact that they're very small is also quite useful. Other types of stem cells, and probably most popularly used, are the so-called mesenchymal stem cells. And mesenchyme is the mesodermal layer. The mesoderm likes to make musculoskeletal things: ligaments, tendons, cartilage, muscle, bone, and even fat. They're often derived from fat. They're also derived from bone marrow. And these cells are much bigger. They're roughly 12 to 30 microns. The V cells are only 1 to 2 microns. The V cells are about a quarter the diameter of a red blood cell. So if these cells are given IV, the MSCs at their diameter have trouble getting through the 6 micron average diameter of a pulmonary capillary. They tend literally to most get filtered out in the lungs. I've seen numbers on the order of 95% don't get past the lungs. Whereas the V cells at 1 to 2 microns, they're so small they easily get to the lungs and they can go everywhere from head to toe. Because
including the brain.
Including the brain. And because they are pluripotent, they literally can provide a head-to-toe biologic regenerative effect. They're so early in differentiation, our theory, it'll take a while to prove this out, but it is likely that the V cells not only can replace an adult cell with a much younger version of that cell, they probably are able to age reverse even the stem cell pools in the body, because other types of stem cells in the body age.
Oh, that's very interesting. So these pluripotent cells, they remain very, very young. And so if we take the cell from, say, a 90-year-old person and turn them on using the song laser, which I'm sure you're going to go into, then they still benefit from the power of a very young cell, correct? That's exciting.
It is exciting. Because we're using their very young stem cells that can go anywhere. We've seen significant benefits in people in their 90s.
And it's from their own product, their
very own cells that have stayed young, circulating in their body all their life.
Right. So that's one of the key unique ability of these miracle cells.
Part of that term is, poetically, we sing the song of the stem cells in light, first to awaken them from their lifelong sleep, but then to actually give them a directional guidance signal. What's unique about the song laser is that we take the output of an ordinary laser, and with a special optical device that I invented with Scottish physicist Scott Strachan, we rearrange the relationships between the waves. Normal laser waves are in phase, and that creates an amplified wave. We've created the ability to give each photon its own address through the optical device that it goes through, so we can combine them exactly out of phase. And when you do that, you create a sum zero of the vectors. So when you have a vector sum zero, as this combination of two waves, they basically cancel each other. The light becomes invisible. And its depth of penetration, based on the physics, goes a lot deeper. That part of the waveform probably goes all the way through the body from one side to the other. And we've had as many as 4 people in a row feel that effect if they were sensitive. Then there's another part, the visible light that remains, that is no longer in the typical waveform relationship. It is, without getting too technical, a combination of how the waves combine and get stronger, or how they combine out of phase and get weaker, and it results in little islands of light that are called sparse nodes of constructive interference, like little islands, little starry seas of light that are flickering and moving quickly through tissue in a background of the darkness of the waves that are canceling each other. And the name we get for that my colleague Scott did, is sparse constructive nodes. So SONG is also an acronym like LASER, which stands for a Strachan Ovokaitys node generator, because it's generating these little wave packets that he modeled to go 10 to 20 times deeper than ordinary laser. So the benefits of photobiomodulation, which are well known, the benefits of low-level lasers, can go 10 to 20 times deeper through the body. And because of this signal that goes deeply through the body, and our early work at the NIH, that showed that if we pass this beam through a flask of stem cells, or at least stem cell-like cells with the first experiment, that the cells are attracted to go where that signal is, and even to stick to each other. So we literally happened upon, that was our first eureka moment when we saw that effect, a way to increase the probability that a stem cell goes where you direct it. So the first part of the process is drawing blood, doing a separation and concentration process, remove the red and white cells, just have plasma, platelets, and the sleeping stem cells, wake them up with a SONG laser, give them back intravenously. They go everywhere from head to toe, and we, using the SONG laser in a usually 20 to 30 minute laser guidance process, individualize it for where that person would most benefit from a regenerative effect. And it's more of a quantum concept that we increase the probability that a stem cell goes in the three-dimensional volume of tissue where it will give them the most benefit.
And one step further, you also combine the music with the healing frequency. So I'm really a fan of multimodal therapy and using different therapy, different modes. And so would you also talk a little bit about that?
So we talked earlier about medicine, and it's not just how you say a logical application of science. It is that, but there's also the art of medicine. And there's even a group I've spoken to in Europe that's looking at creating a whole media program about the combination of art and science. There is a whole realm of literature about the health benefits of certain types of music. Of course, you've heard of the so-called Mozart effect that tends to help people concentrate, reduces stress. Interestingly, there's even new evidence about the health benefits of singing. That
Humming, singing.
Singing, primarily actually just the simple benefit of a good hum. And there are several aspects to it. From the physiologic sense, humming in a way that you're simply relaxing into it, or using a powerful seed syllable sound like Om, just a simple is said to reduce the so-called stress response. And we talk about stress, which is known to be a factor that tends to make everything worse. The more stressed, whatever it is, it tends to be aggravated.
And we are surrounded by multiple sources and layers of stress.
We are indeed.
Right? And so that is an easy way just to turn on the vagus nerve and control that.
Exactly. So if we talk about the so-called autonomic nervous system, there's two parts. There's the parasympathetic, the rest and regenerate, and the sympathetic, the fight or flight.
Which we need them both. We just need to modulate them.
Right. But most people tend to be overdriven in the fight or flight mode, and unless they actually do something intentional, may not really get into the rest and regenerate mode, and that's where the vagus nerve comes in. The vagus nerve is the largest and longest nerve in the body that literally exits the neck, goes all through the chest, provides innervation to the heart and lungs, then goes all through the digestive tract. And the idea of enhancing vagal tone, so-called
Mm-hmm.
vagotonia,
Mm-hmm.
then shifts the balance from being, from in many cases, people are overdriven in constant fight or flight, to
Mm-hmm.
create the balance back
Mm-hmm.
more into the rest and regenerate.
Right.
And humming is one way, simply
Mm-hmm.
to reset the vagal tone and get into a relaxed
Mm-hmm.
state that then reduces stress, that reduces the adrenal cortical stress response, so it can lower
Mm-hmm.
stress cortisol levels, lower it back towards or into the normal range. It also has immune enhancing effects,
Mm-hmm.
uh, neurocognitive effects. So there are all sorts of benefits to a good hum.
Right. And so with the VSEL procedure, we start out with a simple, easy blood draw,
Mm-hmm.
and then we use a special centrifuge to separate out the PRP.
Mm-hmm.
And then we use the song laser to amplify and wake up these little cells, little very small embryonic like cells. And then we infuse back through the IV. And then we use the laser, and uh, there's various protocols
Mm-hmm.
depending on what we're trying to target. Um, the brain, the pancreas, um, thymus gland, and so forth.
Mm-hmm.
And combining that with the music
Mm-hmm.
as well to kind of uh, turn on the vagus
Mm-hmm.
nerve.
Mm-hmm.
And so I just love the combination. And from my own experience, having it done to myself and uh, my patients, oftentimes we feel something, and even people in the room.
Mm-hmm.
So it's something that is beyond what we can see,
Mm-hmm.
but definitely can feel.
Right. Vibrational environment that supports the maximum regenerative result.
Mm-hmm.
Mm-hmm. So I started studying lasers when I was 8 years old. I could tell in the third grade that laser stood for light amplification by stimulated emission of radiation.
Mm-hmm.
I've always been fascinated by that, so I thought it was cool that it was an acronym. So I think it's even more fun that song is also an acronym
Mm-hmm.
that means something more than
Mm-hmm.
just singing the song of the stem
Mm-hmm.
cells. That was where it began, and the creation of the laser has its own backstory that even includes a good old-fashioned vision that resulted in creating the first device, particularly with the fascination of creating what are called phase conjugate waves.
Mm-hmm.
So when you combine the waves out of phase and you get a vector sum zero, it adds to a straight line. Another way of showing that is the waves in phase again, but going in opposite directions. And the fascinating, if not provocative part, is that even conventional physics would define the wave going backwards is not only going backwards in space, but also going backwards in time. So I was very interested in the concept of creating a quantum time machine.
Mm-hmm.
So I built my first time machine when I was 10, which had a magnetic engine that actually did some cool stuff.
Fascinating.
Mm.
That time machine concept
Mm-hmm.
is fascinating.
Exactly.
Mm-hmm.
And then when I was 13, I began studying DNA, and that was my big fascination because I had the insight then that if we fully understood DNA and everything about it,
Mm-hmm.
we would know how to live a very long time in very young bodies
Mm-hmm.
and probably have the key to reversing any particular uh, abnormal health condition. So
Mm-hmm.
those were the roots of it. And I ultimately went to the program at Johns Hopkins, not so much really because I wanted to be a doctor, but to keep all the avenues open for studying and working with DNA. And when we built the first laser system, we didn't really know what this new form of energy would do. And a colleague of mine at the NIH very kindly allowed me to do an experiment in her lab where we passed the beam through a flask of stem cells for different durations. And in all 5 flasks, after we put them in the incubator for 24 hours, the cells had lined up where the beam was. So
Mm-hmm.
that was the first eureka moment. And then when I learned about V cells, the second eureka moment was when we uh, had a method. A colleague of mine very kindly made a pre-preparation of these cells, and we used the laser to activate them in wells. And 4 days later, they went from being 1 to 2 microns to being much bigger at 4 to 6 microns, and they showed the ability to begin replicating then. And that was almost beyond eureka to an OMFG moment.
Mm-hmm.
So the ability to awaken these dormant cells and make them useful, and to further enhance the utility by increasing the probability that you want them to go,
Mm-hmm.
and they're also young, they're also an ideal match for that person, that gave rise to all the work that has followed.
Mm-hmm. Yeah, that's fascinating. You are definitely a scientist, researcher, beyond just a physician, just like myself.
Mm-hmm.
And I'm on the other end,
Mm-hmm.
very fascinated and very curious, and always on the lookout for the latest research based,
Mm-hmm.
science based um, applications
Mm-hmm.
for clinical practice.
Mm-hmm.
So I'm on the other end, receiving all of these exciting new procedures. So I really appreciate that.
Mm-hmm.
Um, so, what are the applications of these cells?
Probably the most fascinating is this whole concept of going beyond mere anti-aging. I was giving a presentation in Boston, and at this event, Dr. Sinclair was presenting, Dr. Church, who was
Mm-hmm.
famous for CRISPR, was presenting,
Mm-hmm.
and he made a comment that I agree with. He said, anti-aging is boring.
Mm-hmm. Mm-hmm.
I mean,
Just yesterday.
right.
We move way
That,
beyond
that,
that.
that's last century.
Mm-hmm.
And anti-aging is the idea that if literally you're kind of sliding down the mountain, that uh, if you work really, really hard, you can slide down more slowly and be um, a younger version than you would be with a lot of work, but it's still kind of, you know, always going downhill. The concept of going back up the hill to a state of vibrant health, more youthfulness, more functionality,
Mm-hmm.
and literally being able to sort of retread and achieve a higher level of health um, than you might have even when you're at the younger age if you do the diet, lifestyle,
Mm-hmm.
exercise, and all the other biohacks that can be added to it. So age reversal is what excited him and is what I think is the most exciting. And we did a 2-year study with arguably the leading diagnostic company, True Diagnostic, that has a test called True Age,
Mm-hmm.
which uses the most accurate biological aging clock that exists, which is a little technical.
Mm-hmm.
It has to do with something called DNA methylation, which
And
is
we use that on
mm-hmm,
all of our patients
mm-hmm,
to see the baseline, to track and
mm-hmm,
see what happened.
right. And it's the most accurate clock. The other clock is the telomere clock.
Mm-hmm.
And I had the pleasure of meeting the inventor of the clock, Dr. Stephen Horvath of UCLA, who
Mm-hmm.
also founded an organization called the Clock Foundation because he's really into biologic age. He's created clocks for 26 different species, not just people. And
I did not know that.
mm-hmm, yeah, mm-hmm.
I always learn something new talking to you.
Thank you. And his comment was that while you can get a relative measure of reversing age if telomeres lengthen, that the telomere clock was only 14% accurate. The clock that's based on the placement of methyl groups on DNA, which that placement is very important for how that particular type of cell functions. And I won't go too deep into the technical details of it, but there are millions of these methylation points. And the most comprehensive test can actually look at about 1 million of those methylation points. I think it's called the Illumina chip, which is what True Diagnostic is using.
Mm-hmm.
And the pattern of how that changes, it's basically the idea of a copy of a copy. There's this complex methylation pattern throughout the DNA, and the cells divide, it copies that pattern, but just like copies of copies, it isn't always completely accurate from
Mm-hmm.
copy to copy. And the way that pattern changes over time gives a more accurate measure of the actual biological age clock at the DNA level.
Mm-hmm.
And over 2 years, we accumulated data. And what was interesting The first data we got was for persons that hadn't had a previous test, because you can't do the test, so you have the test.
Mm-hmm.
And it was an interesting comparison. Dr. Greg Fahey of UCLA, who I've also met, who's a great researcher, did a study that had a very high impact where he combined three things, as you know, DHEA, metformin, and growth hormone. And he did that for a year and found that people were about 3 years younger. He was also working with Dr. Horvath at UCLA. And 3 years of age reversal was very significant. He also showed thymic regeneration. The thymus gland that peaks at age 15 and tends to regress after that was actually regenerating. Very significant and important study. And yet when he showed his data at 5 years, that age reversal had regressed back up to people's chronological ages. So it wasn't a permanent effect. When we did our first testing, we found that if someone had had one of the VSEL procedures in the past 5 years, that our protocols, we found that their biologic age was usually the same or even a year to a year and a half older than their chronological age. So what was compelling was that if they'd had a treatment any time in the past 5 years, there's already 3 years of biological age reversal. What got interesting was if they had a second treatment, because then we typically saw about 6 years of biological age reversal. And most interestingly, with 4 treatments, we even saw 12 years of biological age reversal.
12 years.
12 years.
12 more years.
That's not bad.
I'll take that.
Right?
You know, like you can do so much more
Mm-hmm.
in 12 years. That's really amazing.
It's pretty good.
Exciting.
Right?
Very exciting. We just saying that, but when you really think about that,
Mm-hmm.
To have more functional years
Mm-hmm.
is very exciting.
Mm-hmm.
Mm-hmm.
And over the 2 years, the people that were really
Mm-hmm.
aggressive, that were really adventurers or pioneers in seeing how far they could age reverse, the group that had 2 to 3 treatments each year over those 2 years, we have a group that's 12 to even 18 years younger biologically than their birth date age.
Yeah. So I had my first one done.
Mm-hmm.
So the second one is I'm gonna have it done very soon, and we'll see. Maybe I'll take 25.
That's a good target.
Yeah, 25 is good. So the unique things about VSEL is that they come from your own, and so there's really no downside, no side effects. Correct.
The one thing that we do see, because the cells are young and robust, it's a relatively smaller percentage, maybe 10 to 20% of people may feel, probably from these very young growth rejuvenation factors, a feeling of fatigue for a day or a few days, which generally passes and then the energy comes back to where it was or higher. Some people have that effect, so we warn people about that. And some people are,
Or the opposite,
or they're
right?
energized right away. Yeah,
Right.
that also happens.
Right. So I haven't seen. I do warn people of that possibility, but I haven't seen that. But it's
It can happen.
It's good to know, right?
Yeah.
And everyone's different,
Everyone is different.
right? And so VSEL is one of the exciting option for regenerative therapy, and regenerative medicine is just the field of using your own body ability to heal and repair, and to really go after the root cause of issues.
Right.
So that's why I'm just fascinated about this whole field. And let's talk about young plasma exchange and why you're here.
Okay. Let's do that.
Let's do that.
Want me to give the description? You're
Yes.
doing the procedure, but I can tell you my understanding of what it is and does, and how the combination appears to be very interesting.
Yes.
So, young plasma exchange is literally just that. It's a process that's really two parts. The first part of the procedure is actually removing the plasma of the person receiving the protocol.
Which you had done
I
yesterday.
had that done
The first
yesterday.
leader, right?
So the first leader.
And here you are.
Wow. And there's two elements to the regenerative effect. And the first part of it would be described as diluting or reducing inflammatory chemistry. And you've probably talked about in your previous chats about this issue of senescent cells. When cells get to a point that they've had all the divisions that they're going to have and they stop dividing, they go into senescence and they stay alive, but they become very inflammatory. And that inflammatory chemistry can accelerate the aging of the cells around them. There's a whole realm of therapies called anti-senolytic therapies, beyond the scope of today's discussion. That is one of the factors. So the first idea is that removing plasma that might have accumulated various types of inflammatory chemistry, and then replacing it with plasma from a young person that's free of that inflammatory chemistry. The first part is just diluting the things that are potentially inflammation enhancing and age accelerating. That's the first part. But the second part is
inflammatory byproducts,
right.
and including autoantibodies for people with autoimmune issues, even before they have any symptoms.
Right.
So it's just kind of like, I think of it like taking the trash out since it accumulates over time, or like an oil change. Right. For the engine to run at its best, and you just have to regularly remove the old oil before you put in the new good stuff.
Put in the new lubricant.
And so young plasma is from donors 18 to 25. So this is like the peak for productions of hormones of various kind, exosomes, stem cell. So we take the advantage of that.
Right. So, as you say, I kind of like the metaphor of changing the oil. So it's removing the dirty oil and putting in really good clean oil, or removing the trash and just having a clean landscape. That's part of it. And then it's also about the quality of the oil that's being put back in. And the young plasma has hormones, exosomes, cytokines,
with
growth factors, and also has the vibrational imprint of someone that's biologically young. And there's evidence to suggest that our epigenetic optimum is somewhere 22 to 25 years old. So it's also giving the information of epigenetic optimum.
Yeah. So take the trash out and put in new fancy furniture. So this has been really, really fun for me, and I learned a lot more. And I look forward to seeing you again and for more conversations. But now we're gonna get you to the next room to start our second day of the Young Plasma Exchange. And then I would love to follow up on how you do in 6 months.
Yeah, who knows what that will be. I'm very excited about that, to have the first experience of this combination. I'm excited to see what the results will be, and I really want to compliment you on having created a beautiful space and doing what it takes to use this very innovative type of platform.
Thank you so much. All right.
Yep.